I'm a pediatric cardiologist here at Texas Children's Hospital and Baylor College of Medicine. I specialize in care of children with conditions that are genetically mediated that cause their heart disease. So we call that the cardiovascular genetics program.
At birth, I've heard I was born with Larson syndrome. Not really sure what it is. And then they re-diagnosed me with Marfan syndrome. And then when I turned 12, Dr. Morris diagnosed me with Loeys-Dietz. She looked me straight in my face and said, "You don't have Marfan syndrome." And I was like, "What do you mean?" And she was like, "No, you definitely have Loeys-Dietz."
When I first started, we mainly knew about Marfan syndrome. And so now we know with rapid scientific advancement and so many of my colleagues in the field that there's many other conditions that are related that can also cause aortic dilation, aortic dissection, aneurysms elsewhere in the body that sort of can resemble Marfan syndrome.
Dr. Morris, she really and truly does go above and beyond for me. She's the first person I call if there's something wrong, and she'll pick up, she'll be like, "Okay, we'll get it figured out," and she'll help you do whatever needs to be done.
I'm just so fortunate to work in a place where I can focus on conditions that I'm really passionate about and that I can see patients that I love taking care of every day. I couldn't do any of this without our team here at Texas Children's. You know, when I first started, it was just me, and I had a geneticist that would come over sometimes to clinic. And we've grown the program to, I think, is the highest quality that there is. You know, we have better skeletal interventions, we have better understanding of mental health, we have better understanding of exercise, and that's getting even better. So I think also taking the whole person into account rather than just treating patients just for their cardiovascular disease has been a big change.
I'm one of those people that likes to overthink a lot, and I have a lot of problems with my health, but she's one of the ones that are like, "It's okay, we'll figure it out." She's helped me with therapy and physical therapy. I haven't had a doctor that's done more than that for me, so I'm very appreciative.
The donations are so important. I mean, it is really hard as a clinical outcomes researcher. Getting funding is really hard these days, especially as funds are directed elsewhere to other priorities. It's very, very hard to conduct research. And so I've been so lucky that the Marfan Foundation has funded some of these projects. So I just hope we continue making advances and eventually so they can just live a long, healthy life like everybody else.
I feel like there's not a better person for this award, honestly. She's hands down the best doctor I've had. And when it comes to my heart problems or my Loeys-Dietz or any other issue that has nothing to do with my heart, she's the first person, always gonna be there, no doubt about it. It's no other person I feel like deserves this award than Dr. Morris.